Have you ever wondered how chiropractic care could help your baby nurse better? I am Dr. Stephanie Barto with Barto Family Chiropractic, and today I'm going to discuss those things with you. Okay, so some of the most common nursing and feeding challenges that moms experience are latching difficulties, low milk supply, discomfort with the baby at the breast, and baby fussiness during feedings. Now, the reality is almost all of these issues can be related to physical misalignments in the baby or the mother. And here's kind of how that happens, all right? There's three things that a baby needs to be able to do to nurse appropriately. They need to be able to open their mouth, they need to be able to work their tongue appropriately, and they need to be able to turn their heads. Now, what can happen, because the birth process is like a heck of a thing to go through, misalignments of the neck as well as the jaw can occur that can challenge the neurology and cause variety of function. So if we have misalignments of the jaw, baby doesn't get to open their mouth correctly. If we have misalignments within the bones of the skull, that's going to change how the nerves that come out of the brain go right out into the mouth, how they can coordinate a suck, and how they can coordinate tongue motion. And if you have subluxation in the neck can change how well baby can move side to side, and it can show up as a baby who prefers to nurse on one side or the other. Now, sometimes you can hack the nursing process by changing like a nursing position. But if you really want to get to the true cause of it, we need to look at what's happening with the spine and the nervous system. Okay. Now, when babies get adjusted, it's not like a Chuck Norris thing. All right. If you're seeing a chiropractor who knows what they're doing, they're not doing any forceful cracking or twisting of a baby's neck. That is just not what's happening. Adjustments for babies are very gentle, very light. Most cases, a very light sustained pressure, no more than you could comfortably touch your eyelid. It doesn't really take very much just to get things get those misalignments balanced out, improve the neurology, and in most cases, moms start to experience a change in the latch and the feeding immediately. When baby can suck more appropriately and drain the breast better, that's going to help moms with a lot of low supply issues. So we've actually had so many moms in the office experience this benefit, all right? I'm also, just this year in 2024, I got my certification to be an IBCLC because I just wanted to make sure that if a mom was seeking out, if they're having a breastfeeding challenge, they think they need to get a lactation consultant. And sometimes, you do need that help, but you also need somebody who understands the biomechanics and the neurology behind all of that. So I wanted to make sure that I had both of those knowledge, those fields of knowledge, and I could combine it and offer that care to the moms here. Now, the other cool thing about all of this is that your nervous system does so much more than just being able to coordinate a latch. In fact, I would say that nursing and your baby's ability to be able to nurse is the very first milestone. This is critical to their life and their survival. And so they should be able to do these things. And if they can't, then it indicates a really big problem. Now, thank God we live in a society where we have bottles and formula and things like that. But the reality is that a healthy baby should be able to nurse and nurse effectively. So that's the very first milestone. And we get that nervous system on track. And then we just make sure that they hit all of their other growth and developmental milestones just the way that they were supposed to do. So if you are a mom or you know a mom who is struggling with nursing, and it can be so hard and just such a difficult thing for moms to go to, share this video with them. Let them know that there are providers out here that can help, and give them one-stop shop for a comprehensive, is it a latching problem? Is it a chiropractic problem? Is it a lactation problem? We got one stop and we can get all of it taken care of right here. If you've liked this video, like it, subscribe it, share it, do all of those things, please. It really truly helps us as a small business reach more people so that we can have a greater impact on them.